what is lung cancer? Lung cancer is a type of cancer that begins in the lungs, and this typically happens in the cells lining the airways. The lung cancer is actually one of the most common and deadliest forms of cancer worldwide. And there are two types of lung cancer. The first one is non-small cell lung cancer, which is the most common type, accounting for 85% of lung cancer cases. And this includes adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. The second one is small cell lung cancer. It's less common but more aggressive, that tends to usually spread rapidly. Some main risk factors are that smoking is the main one, but also non-smokers can develop lung cancer in terms of like their genetics. Or there are two types of lung cancer. The first one is carcinotumors. These are rare, slow-growing cancers that happen in the lungs. Generally, these are less aggressive than other types, and usually they can be treated with surgery. The other one is mesothelioma. It's a type of cancer that affects the lining of the lungs, so the pleura, and primarily it's caused by exposure to asbestos, but this one is really rare.
Now let's talk about some of the things that we can do in order to prevent lung cancer. Some of the things that we want to do is we want to avoid those risk factors that contribute to lung cancer. Some of those risk factors are going to include smoking. Smoking is going to be the number one risk factor for the development of lung cancer. That's any type of smoking, whether you're smoking cigarettes, cigars, whether you're using a pipe or not. Another risk factor is going to be family history. If you have family history, according to the National Institute of Lung Cancer, if you have family history of lung cancer, you have 2 times the chances of developing lung cancer in comparison to somebody who has no family history of lung cancer. Now let's talk about some of the things that we can do in order to avoid the development of lung cancer. So what are some of the lifestyle changes that we can do, or some of the protective factors that we can include? So obviously the number one contributing factor to the development of lung cancer is smoking. And so therefore we want to avoid smoking if you've never been a smoker, and if you currently are a smoker, the goal for you is to quit smoking. You also want to avoid being around anybody you want to avoid being around anybody that is a smoker and avoid that secondhand smoke. You also want to use any resources that are given to you if you need help or if you need assistance. Talking to your healthcare provider is going to be a good way for you to begin in order to get those resources. In the slide, we have the phone number 1-800-QUIT-NOW. You can call them and they can guide you and help you reach that goal for you to quit. Also, did you know that after quitting smoking for over 10 years, you actually can decrease your chances of developing lung cancer by anywhere between 30 to 60%, which is a lot. You also want to have a healthy lifestyle. You want to exercise. You want to keep yourself active. You want to change your diet. Most importantly, having a plant-based diet is going to help. You want to include those vegetables, those green leafy vegetables that we all like that are high in fiber. And you also want to include those fruits that are going to be good for you. Those antioxidants are going to be good for you. But according to the American Lung Association, if you already have lung cancer, high doses of antioxidant supplements can actually not be a good thing for you, as they can interfere with the therapy, whether you're getting radiation therapy or chemotherapy. So it is important to talk to your healthcare provider and come up with a plan for you as far as your diet.
There are 3 types of treatment options for lung cancer. These are just some. The first one is surgery, and this is usually for the removal of a lobe of the lung. And usually this is common in early stage non-small cell lung cancer. The next one is chemotherapy. This is given before surgery to shrink tumors and make them easier to remove. So it's in the combination with surgery and drugs.
My name is Kendra Lyatt, and I'm going to be discussing lung cancer for my presentation. I'm going to start by discussing causes and risk factors. So lung cancer, it's often caused by, in most people, being around someone who smokes or smoking yourself, primary or secondary contact with tobacco, nicotine. And it can also be caused by being exposed to carcinogenic substances such as radon gas or asbestos, which some people have in their homes. And that if you have that, that needs to be removed immediately because of the risk of cancer. Some people work in old buildings sometimes and they don't know it, but it's filled with asbestos, and sometimes they develop illnesses, cancers from their workplace. Or if someone has had prior radiation treatment for some reason to the chest area, that's another factor that can increase the risk factor of developing lung cancer. Symptoms of lung cancer. Lung cancer symptoms can and may include, they vary from, of course, a cough, a hoarse voice, being short of breath, and respiratory infections that you get that may not go away, are persistent, are ongoing, sudden weight loss, and pain elsewhere in the body besides the chest are all signs of possible lung infection.
And these are the references we used for our presentation. In conclusion, there are two types of lung cancer. The first one is non-small cell lung cancer, which accounts for 85% of cases. And the second one is small cell lung cancer. The risk factors are smoking and secondhand smoking. Signs and symptoms usually gradually appear, but mostly it's cough or shortness of breath. Diagnostic tests done for lung cancer would be chest x-rays and CT scans. And the treatment options really depend on the stage of cancer you are in, but it can range from surgery, chemotherapy, radiation, and sometimes immunotherapy or targeted therapy. And this concludes our presentation. Thank you.